Hello, and welcome to Mid-Michigan Health. My name is Cassie, and I'm one of the specialized nurses that will take care of you in the surgical intensive care unit after your open heart surgery. Rest assured and be confident in the fact that our entire purpose here is to assist you during your stay and help start the road to recovery. In order to accomplish this, we've developed a team with you at the center. We have worked very hard to achieve accurate and timely communication regarding your care. We know you have many questions about your upcoming procedure, and that this may even have been an unplanned event. We've created this short video to help answer many of your questions and let you know what you can expect throughout your stay. Feel free to ask us any questions at any time throughout your stay. Mid-Michigan prides itself in having one of the best heart programs in the country. Not only has our program been nationally recognized, our surgical ICU has been awarded the Beacon Award of Excellence by the American Association of Critical Care Nurses. Led by our cardiovascular surgeons and advanced practice providers, the cardiovascular surgery team at Mid-Michigan Health can perform a number of different open heart surgical procedures. The most common procedures are the coronary artery bypass grafting, or CABG, and heart valve surgery. The CABG procedure involves using a combination of vessels from your own body to create a bypass around the blockage in your coronary arteries. It may involve any combination of arteries from the chest wall or arm or veins from your leg. A valve surgery may be performed either by repairing it or replacing the valve. Your surgeon will explain what procedure you're having and answer any questions.
Hello. My name is Eric, and I'm a registered nurse in the surgical ICU at Mid-Michigan Health. You will need to shower the night before and the morning of surgery with an antibacterial soap, such as Dial. Do not apply lotions, deodorant, cologne, makeup, or anything in your hair. If you are already in the hospital, your team of nurses and patient care technicians will help you prepare for surgery. Do not shave at home. The hair on your torso, groin, and legs will be clipped by our staff before surgery. You will not be able to have anything to eat or drink after midnight the day before your procedure. Some patients may need to stop eating at 8 p.m. The pre-admissions nurse will instruct you. Your medication instructions will come from your surgical team in the office. Please take the medications that you were instructed to take on the morning of surgery with a small sip of water as directed. There may be medications your surgeon stops. Your surgical team in the office will discuss this with you. If you were instructed by a respiratory therapist on an incentive spirometer pre-operatively, please bring that with you on the day of surgery. If you are coming to the hospital on the day of surgery, you will arrive at the front desk of the hospital. You will be directed to the second floor surgical waiting room and be escorted to a room where preparation for your surgery will begin. As visitors' guidelines may change, the surgeon's office staff will inform you as to whom may accompany you on the day of surgery. Your family will be given a surgical tracking number to follow your progress on the monitor in the waiting area. They will also receive a pager to assist with communication from the OR and your surgeon. We will keep your family updated on your progress at key points during your surgery. If you're already a patient in the hospital, the staff will tell you who may visit prior to surgery. Someone will direct your loved ones to the surgical waiting room until the procedure is completed. In the preoperative area, preparations for surgery will take place. We will confirm your contact information, verify your home medications, bring your home medications with you or a list of those medications, including the dose and frequency. We will confirm allergies and have you sign consent forms. Meet with an anesthesiologist and certified registered nurse anesthetist. Start an IV. Perform the clip prep to remove hair as needed. Secure your personal effects, including any vision, hearing, or dental equipment. Provide you with medications to relax and a preoperative antibiotic. Answer any questions you may have about your surgery. Once all the preparations have been completed and the OR is ready, we will perform a safety check with a pre-op nurse and your OR nurse, and then you will be taken to the operating room. The average open heart surgery lasts 4 to 6 hours. Your surgical team will be able to describe the process and answer your questions.
When the surgery is complete, you will be taken to your room in the surgical intensive care unit. An open heart recovery trained nurse will remain with you throughout your first night in the ICU. Your family will be allowed brief visits on the day of surgery. We limit visits to 10 minutes every hour to reduce overstimulation. Current hospital visiting hours will resume the next day after surgery. There is daily quiet time from 2 p.m. to 4 p.m. to allow patients a time to rest. Visitation is restricted at this time. Flowers are not allowed in the surgical ICU to reduce the risk of infection. The surgical ICU staff will be able to tell you the current guidelines for age-restricted visitation. Your surgeon will visit with your family and provide an update on your condition following surgery. Your family will be allowed to visit once you're settled in your room and your nurse has determined an appropriate time to speak with them. At this time, the nurse will verify contact information with your family or friends. Ensure they have the surgical ICU phone number and the correct PIN number. They will need the PIN number to gain any information about your health status when they call the hospital. It is important to note that this number is different from the surgical tracking number used earlier in the day. We suggest no more than 2 points of contact per family, as our main focus is patient care. The recovery nurse will discuss the appropriate times to call for updates. It is normal to feel disorientated as the anesthesia wears off and you begin to wake up from surgery. There is a breathing tube, called an endotracheal tube, that is placed in your airway for surgery. This tube is connected to a ventilator, which breathes for you during surgery and for the first hours of recovery. It is not removed until you are awake enough to protect your own airway, and it is safe to do so. This may cause some anxiety. It is important to remember this is normal, and you should try your best to remain calm. Your nurse is with you at the bedside to help coach you through this process. Our goal is to have the breathing tube removed within 4 to 6 hours, or when it is safe to do so, after you arrive to the surgical ICU. As you wake up, the nurse will keep you informed of your progress and will describe all of the things that affect your recovery. While the breathing tube is in your airway, questions will be limited to yes or no answers. You will experience many sights and sounds that will be unfamiliar to you. Let's try to familiarize you with some of the language, equipment, and sounds that you will hear. The day of your procedure will be referred to as day of surgery. Each day after will be referred to as post-op day, such as post-op day 1, post-op day 2, and so on. You will hear many different sounds coming from the equipment in the room. The noises will come from the monitor located near the head of your bed, from the IV pumps, and from the ventilator. You will have many lines attached to your body, such as in your arms, neck, and chest, as well as many cables to help monitor your status. There will be chest tubes placed below your chest, just above your belly. These are usually associated with much of the discomfort you may feel. Drainage from the chest tubes is normal. There will be a Foley catheter placed in your bladder. Other sensations experienced may be pain, weakness, feeling hot or cold, or very thirsty. These are normal sensations following open heart surgery. It is normal to feel pain after surgery. We will do our best to help manage your pain. It is important to remember to communicate your pain level to the nurse and surgical team. Patients often report feeling thirsty or dehydrated. This feeling is a side effect of the anesthesia drugs. They are designed this way to reduce the amount of secretions in your mouth. Fluids will resume slowly at first until you are able to tolerate them. As you recover and the effects of anesthesia wear off, you will progress back to a regular diet.
The morning after surgery, the nursing team will get you out of bed for the first time and assist you with transferring to the chair. It is important to communicate with your nurse if you are feeling dizzy, lightheaded, or nauseous. Each day, the night shift will get you up to the chair around 5:30 or 6 in the morning. You can expect to stay up in the chair until quiet time at 2 p.m., when you can rest in bed. At 4 p.m., the team will get you back up and into the chair for the rest of the day until bedtime that night. Early mobility is a key element to a successful recovery. Regardless of your activity level prior to surgery, you can expect to follow this daily routine while in the surgical ICU. You will go for your first walk on the day after surgery. Your nurse and the surgical ICU staff will guide you through this process. Each day, you will increase the distance and number of walks you take. You will be giving a heart pillow. We want you to bear hug this pillow when you have to cough. This is a splint for your chest. It will help stabilize your chest when you cough and will help control some of the pain. Coughing will help clear secretions from your lungs and assist you in your recovery. You will be provided an incentive spirometer. This device is designed to exercise and re-expand your lungs. The incentive spirometer is a critical tool in the prevention of post-operative pneumonia.
The average hospital stay is 5 to 7 days for a scheduled surgery. Our program is designed to optimize the continuity of care throughout your stay. When discharged, you will be given instructions for your return home. This will include limitations, wound care instructions, medication schedule, follow-up appointments, educational information, and information for home care and cardiac rehabilitation. Goals for your individual progress will be set to meet your specific needs. To support you after you leave the hospital, your care team includes not only the cardiovascular team, but also the discharge planner, pharmacist, dietitian, and social worker. There are 5 key goals to reach before you can be discharged safely from the hospital. You must be thinking clearly. It is important that you can recognize changes in your recovery and communicate your needs effectively. You must be able to increase your activity and mobility each day throughout your stay. You must be eating, and your digestive function must be returning to normal. Nutrition is a critical component of the healing process. Pain must be controlled with oral medications. You must be accomplishing your incentive spirometry goals. The incentive spirometer is a key device in the prevention of post-operative pneumonia and optimizing your lung function. You will receive a complete set of discharge instructions and education related to your stay in the hospital that your nurse will go over in depth. Here are a few key items included in those instructions. No pushing, pulling, or lifting more than 10 pounds for the first 8 weeks. You will have follow-up appointments at 2 weeks with the nurse practitioner and at 4 weeks with your surgeon after you leave the hospital. Home care will provide care for the first 4 to 6 weeks after discharge. Cardiac rehabilitation will start after your surgeon has cleared you for increased activity, usually after your 4-week visit. Cardiac rehab lasts around 12 weeks or 36 visits. It is preferred to have someone stay with you most of the time for the first 1 to 2 weeks after you go home. Your cardiovascular surgical team, the staff of the surgical ICU, and everyone at Mid-Michigan Health are here to provide you the best cardiovascular care available in healthcare today. We wish you well in your recovery, and thank you for choosing Mid-Michigan Health.